Well, hello there. My name is Marie Mayu, and today I'll be doing tits and tats and this and that. This is our episode all about health information. Now, I've been told that I have to do an assignment, and what we're going to talk about today is simply my father, and his name is Mark Mayu, same as my last name. So we'll get right into it, into the nitty-gritty. I don't need to talk too much about what I'm doing because you already know. So, Mark Mayu is a 39-year-old male. He's physically fit and he lives at home in a large family and has a great support system. Patient is a smoker. That's bad for you. He has a history of sinus problems and no other pathophysiologies. The patient is having a spinal discectomy, laminectomy, and a fusion of the L5-S1. That's down below, don't you know? So, as well as a hip bone graft to go into that space. So the injury was acquired to this man during a search and rescue call, and he got hurt very badly, and now he had a herniated disc, and they need to go in, take out those pieces, fill it in with bone chips, close it up. Bob's your uncle. Question 1. What instrumentation is necessary for the procedure? Well, I'd like to show all of the instruments that I'm going to need to you. However, I don't think that's a possibility, simply because I don't have them. But if I had to take a guess, this is what some of them would look like. So the instrumentation set is a posterior lumbar interbody fusion instrumentation set. In there you would find dissectors, a holder, an impactor, a spreader, of course. We would also have a rectangular bone curette, amongst many other things. We would have detachable trowel spacers, a bone rasp, a graft funnel, and a graft pusher, a graft packer, and of course a quick release T handle, which could also be this. So my patient will be in a prone position, of course, because it's a back surgery. And prone looks like this. Unless you're a Barbie, it could look like this, possibly this. But I don't think we'll be doing that with our people. Furthermore, complications of this position are simply that it's damn uncomfortable. They'll be bent in a knee bent position with their face on the table, and we will be showing you that momentarily with my live demonstrator. So once my patient is anesthetized and intubated, we will have them on the table like so, and it will require 4 people to roll my patient like so, if my fingers were people, onto the OR table like so. It seems easy enough, but it isn't. You also want to make sure that perhaps the C-spine is in a neutral alignment. That's very important. You could hurt somebody. So the legs would be maintained in a long axis of the body position until the table is broken, in which place you would have protective padding under the knees, in front of your thoracic part of your body. So we're going to pad the arms, of course, so we don't hurt the ulnar nerves or the radial nerves or any other nerves that are running through the arms, because it's very important. Also, we're going to pad under the knees, and as well it'll be a soft environment that the person will be laying on, and hopefully, if you're a nice guy, you would have one of these for someone's face to go through, so they don't end up with a face ulcer, a pressure ulcer on the face. I know you haven't heard of it, but it's possible. Now here we have our patient in the prone position, laying on the hard floor. This is Marky, he's my brother. Can you say hello, Marky?
Mm.
Now Marky, would you prefer perhaps a padded floor?
Yes.
Now why is that?
My nose is flat.
What? Say that again. Why would you like a padded floor?
My nose is sore.
Your
and
nose
flat.
is sore. What else doesn't feel good, Marky?
My chest, my knees,
Okay.
all hurt surface.
Everything hurts. Everything hurts because we didn't pad it. So those are some things we need to consider, isn't it? Maybe some jelly, maybe some foam. The patient is secured to the table with a tapered belt across the thigh. immediately under the buttocks. Has to happen or the patient will roll off of that table, and that will be the last we hear of them. So to prep our patient, I intend to use something that's pink, something you shouldn't put on your eyes, and something that you require a couple showers for before the procedure. And that is called chlorhexidine gluconate. It's a lot of words. It needs to be said. So yes, as I said, I will tell them to keep it out of their eyes, ears, mouth, and nose, as the only things that are supposed to go in there are fingers and toes. A major drape setup will be needed, and the patient will drape using 4 small drapes to go around the incision, as well as your major, and I know that I'm missing a drape in there that goes on before all of this. However, if I were to show you briefly what it would look like, hypothetically saying that my patient is laying in the bed, prone position, it would look like this. Yeah? This drape will be disposable. In my case, I will use the reusable drapes because I prefer them. We'll be doing a partial count for opening and closing, and the classification of the wound is a stage 2 because it's not dirty and it's not infected, and it's just a surgical incision at this point. And the types of sutures we'll be using a Biosyn 2.0 absorbable suture, most likely on the inside, a little bit somewhere in there. Also, we'll be using the Vicryl sutures and some steri strips and a pressure dressing to stop any bleeding that might be coming about. Once you cut somebody open, these things tend to happen. So I would also place my cautery pad, preferably on the thigh, closest to the wound. Is there a specimen? You're goddamn right there is. It's the herniated disc, and what are we going to do with it? We're going to take it, we're going to put it into a little container with formalin in it, and we're not allowed to touch that either because it's not good for us, and we're going to send it up to the lab and say, can you please get rid of this? Why? Because it's not cancer, it's not something like that, it's just something that happened and we needed to take it out. And I think that's it for me today. Thank you for joining us, and please don't mind the small polar bears in the back. I know we're out here in the cold weather, and I want you to stay safe, dress warm, and don't run with scissors. Take a bow, Marky. Thank you for your hard efforts. Thank you. Good night.